My talk today was about lessons learned from Choosing Wisely initiative, I would say globally, but I was really focusing on the Choosing Wisely Africa, which is an initiative that comes as following other Choosing Wisely initiatives globally, such as Choosing Wisely in oncology, the US, Canada, and India. And what we're trying to say is to encourage a dialogue between physicians and patients, but also to some extent to also have a dialogue with policymakers who are responsible for cancer care in different countries in Africa, specifically Sub-Saharan Africa. And the Choosing Wisely initiative, as I just said, is to make sure that the practitioners, and these are the oncologists on the continent, be clinical oncologists, radiation oncologists, surgeons, to make sure that they don't prescribe treatments or interventions that are of low value or costly to patients and which are not supported by clinical evidence. So we're doing this initiative. We published our first paper in 2020 of the 10 recommendations that were crafted by physicians, from different disciplines: radiation oncology, medical oncology, surgeons, policymakers, and patient advocates. And while it's not exhaustive, it's a list that is starting the conversation. And that's the conversation we're having even right now with fellows here in Senegal. So basically, that's what we are trying to do, encourage to de-implement practices that we think are of low value, harmful sometimes to patients, and that lack evidence. So that was the snapshot of the talk, but also talked about the barriers that we see in terms of implementing Choosing Wisely Africa initiative, such as patient-related barriers, healthcare providers-related barriers, health system, but also the society at large. We talked about the fact that some hospitals actually generate income by doing a lot of interventions, a lot of testing, and hence, if you don't understand those concepts or the context at which some of these, practices are done, you would not be able to implement or de-implement this practice. You have to understand the context, and also we have this perception that sometimes patients believe that when you do a lot of things, let's say tests, then you're a good doctor. And when you do less, you're not a good doctor. So we have to try to understand all these contexts so that we are able to advocate for the implementation of the practice. So we also shared about this in our talk. And we also talked about the next steps, which are going to be measuring the impact of these recommendations. Are we really, from the publishing the list alone, are we really going to see the impact of Choosing Wisely initiative in Africa? So we are now starting measuring the impact of this recommendation in different countries as a pilot, including Senegal, Rwanda, Ghana, Kenya, and Tanzania. So we also shared about that, and hopefully soon we are going to be publishing the outcome. But we also talked about the validation of the list, which we did this year. Actually, we published an article about the validation of the Choosing Wisely initiative, and what we did was surveying frontline oncologists, asking them about whether they agree with the recommendations, whether they will be able to implement the recommendation in their practice, and also asking them the challenges that they think they will meet in implementing the practices, and all these are things that we discuss in our talk. As I said, it's one way to actually raise awareness of the concept of the initiative, because publication is not only way to make it known. It's one way, but there are other several ways to make sure that frontline oncologists are actually aware of the initiative. One is publication. Two is talks like such as this or events such as this in Senegal, where different practitioners are coming to attend and understand the concept. But also, what we even also said in the talk actually is that by printing out these recommendations and put them in consultation rooms in the hospital wards is also a way of raising awareness. So events like this, if we are carrying them out actually in several countries, right now we are starting here in Senegal as the first Choosing Wisely Africa event. Next year in February, we are going to go to Tanzania, and there are other plans to go to Kenya, Rwanda, and also Ghana probably in the next few years. So these are events that are going to help us to raise awareness of the concept and the initiative, and hopefully many people will be attending so that they can implement in their daily practices. I mean, it's really to encourage my fellow colleagues, oncologists, to always think about, 3 questions before they prescribe or order a test. One is to always ask, should I really should I order this test? Is it going to change anything in terms of the management? In terms of treatment, should I really prescribe this treatment? Is it evidence-based? Is it going to change the survival or the quality of life of my patient? And also to always consider patient in the daily practice that we're doing. The financial status of the patient is very important to know. And all these, once we ask all these questions, I'm very sure that we'll be able to, consider that what we are doing is of great value to the patients and really not harmful, not going to cause a lot of financial toxicity to the patient in terms of the treatment, but also financial toxicity to the patient because of the several tests that we are doing. And this will be important to our care.